Good morning again. It's fantastic to see you all. We're very, very happy that so many people are interested in joining this summer school. We have a fantastic program for you. And I'll start by just saying something about the background of the summer school, how we ended up with this particular program, and I'll tell you a little bit about the outline of the structure of the program. So modern society, we face many, many challenges. There's climate change all over the world. We still have diseases. We have war, also closer to home these days. There's still large areas with poverty, hunger, challenges of getting enough clean water. Many of these challenges are actually not new. Mankind has been struggling with these challenges and trying to meet them throughout our history. What is new, however, is that we are now taking collective action to address these challenges. And that we're doing so against the backdrop of sustainability. Sustainability means that we try to fix our problems now without ruining the planet for future generations. And that's really a game changer, something that we all have to take into account. Now, the United Nations has formulated 17 different sustainable development goals. We won't be addressing all of them. They're all more or less interconnected. But we will be focusing on good health and well-being. But we will not forget about all these other challenges. So we will also keep an eye on using technology for better health to also reduce inequalities in access to healthcare. We want to have an eye on sustainable consumption and production. We want to develop innovative technologies that are available and acceptable for everyone, man and woman, young and old. And we want to do this together. We want to have partnerships, as you will experience this week. So even though we have that focus on good health and well-being, we will have some of these other goals in mind as well. Now, ensuring good health and well-being, it's a rather complex story. It's easier said than done. Really, it should start with prevention, just preventing people getting sick at all. But across the world, and this is just a picture showing you in blue the European numbers, and then in orange Norway, because I'm stationed in Norway, so I'll come back to Norway as an example several times. There's barely any effort, organized effort spent on prevention of diseases and health problems. There is some effort going to, or some resources going to medicines and medical devices, but by far the largest money budget goes to taking care of patients, both in hospitals, outside of hospitals, and then especially in long-term care. We're not just talking about old people diseases here, let me get that straight from the start. It's not just dementia, frailty, osteoporosis, that makes people end up here in the long-term care. It's also children with severe handicaps. Mental issues are steeply on the rise, affecting people of all ages. So we have to look at a lifespan perspective. And the global picture is that we should start at infancy and carry out throughout the entire lifespan. We also see very large disparities across regions. This is just a picture showing, I think it's 30 European countries. The one very obviously missing is the UK. I'm very sorry for that. I'm not the one who erased you from this picture. I was very sorry to see. Oh, you're outside of the picture. But it shows you a little bit. So the blue lines are the European average. And then it shows you how many doctors and nurses are practicing per 1,000 people living in a country. And then again, you see Norway has a huge amount compared to many other countries, a very large amount of both doctors and nurses working in healthcare. We need to be able to have good health and well-being with a shrinking workforce, and that is really a big challenge. So both declining mortality combined with decreased birth rates has led to an increasing pressure on healthcare. Again, an example from Norway. What you see here is that the young people, so under 18, has been relatively stable. This is now. for the last 170 years, but people are getting older. Healthcare has become so good that people live longer, but if you live 10 years longer, you don't necessarily have 10 very good, healthy years. So part of those 10 years, you might also need more healthcare services. And what you see is that the workforce, so people between 18 and roughly 66, was growing for a while. It has been stabilized, and all predictions say that it will start to decrease because this part is not growing. And as these people move into the blue and the orange areas, you get a smaller and smaller workforce that has to take care of more and more people that need healthcare. This is not just typical for Norway. So this is globally all over the world. The green bars are people under 15, and then the darker blue is over 65 years. And what you see, definitely a challenge already in Europe, where there are far fewer young people than older people already now. North America sees the same picture. In the other areas in the world, there's very, very large differences. So Asia looks like it's pretty good, well off, but that's not true for all Asian countries. So Japan, for example, has has more balance that looks like this or even worse. So it's really a global challenge that we have to somehow fix this. We cannot just buy our way out. So already now, Norway is the country in Europe that has the largest workforce in healthcare. So about 15% of people in Norway already work in healthcare. And yes, we have plenty of money, so we could just hire additional people, except that those additional people aren't there. So again, this is across the entire Norwegian country, the different regions. Already now, about 6% of jobs are being filled with people that have lower qualifications than required or completely different qualifications. And 11% of jobs are not being filled at all in healthcare. That's a pretty bad picture. We could, of course, until maybe 10, 15 years ago, try to recruit them from other sectors or steal them from other countries. But that's not really a sustainable way of fixing our particular problem in Norway, because these other sectors, these other countries, they have their own global challenges to deal with. So we need to do that without just taking resources away from other areas. So the one thing that we can do is be smarter and more efficient in healthcare. And this is really what we want to focus on this week. Have all those young, creative minds in the room work together and address, okay, can we think differently? Can we, with the technology that we have, use them smarter, implement them better? Can we come up with completely crazy new ideas that are actually quite good ideas? So that's what we want to work on this week. So can we be smarter, more efficient? Absolutely. If you look at this picture, you see that the relative workforce in industry and agriculture in Norway, but probably a lot of European countries, has really decreased dramatically over the last 50 years. That is because increased automation, increased use of technology, that has really worked in that sector. But if you look at the green, which in this particular case, it's both health and social care, as of 2008, I think we have separate numbers for just healthcare, and then the difference is the social care. You see that we've just kept increasing the workforce in healthcare. That's not sustainable. We cannot just keep adding more and more people, because these people, the few people that we have in the workforce, they also need to be working on other things. So also in the medical sector, there is more and more technology that has been developed, that is being used, but we need to be even more smart, and maybe we need to be a lot better in implementing these services, these medical devices, and make them accessible and acceptable to more people. So that brings me to the summer school. So the overall challenge that we are addressing this week is how we can use digital technologies, both old and completely new ideas, to help cope with increasing healthcare demands and a decreasing workforce without losing sight of sustainability. So that's the overall goal, the overall challenge of this summer school. The more particular focus is that we will look at, or we will have you look at digital technologies for 3 large areas. So prevention of developing a disease or a disease getting worse, monitoring of health status, and personalized healthcare, including self-care. So digital technologies for these 3 areas to foster a shift to more sustainable healthcare, so that it will be available for all of us also in the future. So the objectives of this summer school are for you to learn to understand that this is actually a complex problem. Probably many of you and maybe all of you are already aware of that, but if you really dive into it, it's even more complicated than you could imagine. But we have to face it, we have to work on it. We also want you to understand the potential that digital technologies have to promote healthcare and prevent disease for developing or disease worsening. And we want you to understand better that it's actually challenging to implement digital technologies in healthcare. It's not just an engineer coming up with a fantastic idea, throw it out there and then expect the problem to be solved. Implementing these technologies is part of the same process, and it has to be part of the same process. To be able to do all of this, you need each other. You cannot just have only nurses or only physiotherapists or only engineering sit together, because they will miss a large part of the picture most of the time. So we want you to consider these other perspectives from other people with other backgrounds, multiple stakeholders. That is not just the engineers developing the technology, it's also the patients, first and foremost. It's the people in healthcare that will have to use or teach other people to use these technologies. There is the caregivers that might have a say in this as well. There's the people paying for these things, etc., etc. We have a really, really long list of stakeholders, and you'll meet many of them this week. So we want you to engage with these stakeholders, not just hear that they exist. How do you talk to them? How do you get them interested in your work? And we want you to really experience the power of multidisciplinary collaboration. It's much easier to talk to people you already know and and work with people that have the same background as you, but it's not very innovative. And the really good new ideas, they don't arise when you just talk to people who share your ideas and have similar backgrounds. It's that multidisciplinary collaboration that you will be able to experience this week that will really allow you to develop innovative, interdisciplinary ideas for new solutions and guidelines in healthcare. So very briefly, this is the general outline. So what is the structure of the summer school? So what you see on across the 4.5 days that we have, the white sessions is really us talking about something, presenting you something, followed by discussion. The yellow areas, those are the interactive sessions, discussions, hands-on experiences, inspirational presentations where you really get to talk to the people, and on Friday your own presentations. The orangey, pinkish, I wasn't sure how to call that color, that's the group work, and I'll come back to that in a second. Then we have plenty of breaks. So there is a coffee break in the morning and then in the afternoon. This is really to run to the bathroom, get something to drink, stretch your legs. The real time to mingle and socialize and network and just relax. That is more in the longer lunch break. And then in the evening, all the dinners are homework free. You don't get homework in the evening. So the entire evenings, dinners, we have several really nice social activities. Those are the time for you to choose what you want to do. Whether you want to relax, whether you want to look around, whether you want to network, get to meet people. That's really the social time. Then just a few words about the group work so that you know a little bit about how we structure that, and then there will be much more about that this afternoon. I've already mentioned the 3 overall themes: prevention, monitoring, personalized healthcare. You choose yourself which theme you want to work on. We're not going to just force a particular theme on you that maybe you're not really all that keen to work on. So you choose yourself which theme you want to work on. But then we interfere. And we make sure that within the themes that people want to work with, we end up with balanced groups so that you all can benefit from a mix of different backgrounds, different expertise, different perspectives. And then we stop interfering. And then each group chooses the more specific unmet need in healthcare that they want to address. We give you several examples. just to get you started. You can choose one of those, or you can use as an inspiration and refine it, or you can come up with a totally new topic within that theme. Totally fine. That's really up to the group. And then, like I said, you will get much more information about this, and you'll be guided through this entire process after the hands-on session. Then on Friday we are very keen to hear what you will come up with during this week. So on Friday we have pitch presentations for each of the groups, and we've thought of a few awards that we will hand out. And they'll be like golden buzzers. So the jury members each choose their own favorite for whatever reason. So no formal criteria that you can use throughout the week just to be the winner. It's golden buzzers. Then to really ensure that everybody has the best possible experience, which of course all of us will do our best to achieve, we do have a very short list of house rules. First of all, be an active participant. Ask questions. If you disagree, say so. It's much more enjoyable for everyone. You learn much more, and it's much more productive. But always do so with a background of respect. So even if you disagree, you can always respectfully disagree. But it's important that you say so, because otherwise whoever opens his or her mouth first is just a person setting the agenda. That's not fair for that person. You should be able to say, maybe if we looked at it from this side, from that side. Also, when you see one of you just a little bit outside of groups, engage with that person, get that person back into the group so that everybody here has a really good experience this week. As you may have noticed, we have a cameraman in the back, and he's mostly filming presentations. But he will also do some snapshots during the week so that we can create a really lively video to show afterwards to the whole world. Look what an amazing week we had. Such a shame that you weren't here. And that you can show to your family and friends, this is what I've been doing. If you're not okay featuring in any film, that's totally okay. Just let us know. Not everybody's keen on being on camera. If you want to be on camera, it's easy. You just make sure that you follow him and then you jump in front of him. But don't be shy in saying, I'd rather not. That's totally okay. You can tell me, his name is Alistair, Ali in the back. Just tell him. It's perfectly okay not to be okay to be on camera. Like I said, we have plenty of time for breaks, lunches, dinners, and social activities. What we don't have a lot of time on is in the sessions to be late for everything. And I know that we started a little bit late, and I was trying to catch up, and I'm not sure I managed, but I'll try. So the session, the timings in the agenda are not plus or minus 5 or 10 minutes. If something starts at 10 past 11, we really would like to start 10 past 11. But it means that you need to come back from your lunch break before 10 past 11. Otherwise, you won't be here on time. So try to be back in your seats before the start time. Then something can always happen. Something that is not okay, that you're uncomfortable with. Maybe you need to have a confidential talk with someone about anything, and maybe you don't have friends here yet, or you don't know who to talk to, but you really need to address something. To be able to, for all of you to know that there will always be somebody that you can tap on the shoulder, can I have 5 minutes? There's something I need to talk to you about. So we have 2 safe persons. The first one is Mara, the lady in pink. So you can always address her with whatever. And then the second person is Luca in the back. So these 2 people are prepared to be tapped on the shoulder and have somebody ask for a personal conversation. Of course, you can always talk to me, Lorenzo. I'm not sure about the cameraman. He's very busy. No. But you can always talk to everyone. But those 2 people are aware that there might be something coming up. By far the most important house rule is this one. Enjoy the summer school. I hope you have a fantastic time. I know that we will have a fantastic time. I think you're already having a fantastic time. I hope on Friday, when I stand here again and we say goodbye, that everybody's just beaming at me like, this was just the best ever. So enjoy. Thank you.